welcome to LoveBabz, LoveTalk. I'm Babz Rawls-Ivy. I am delighted this morning to have in studio with me Nicole J. Phillips, who is the Director of Primary Care Services at Planned Parenthood, Southern New England, and Amanda Skinner, who is the President and CEO President and CEO of Planned Parenthood, Southern New England. And so they're in studio with me today because we want to have a conversation about health disparities, Planned Parenthood's benefits. Is that how you say it? Telehealth, and what that means, and just what all this means to our healthcare in the midst of COVID-19. So first, let me say congratulations, Dr. Nicole Phillips, newly minted doctorate.
Yes.
That is very cool. So COVID-19 has upended all of our lives. Everybody's upside down from all walks of life. There's nobody that has escaped what is happening. So those that provide health care are seeing it triple time. Mm-hmm. And so what we're finding out from all this COVID stuff is how wide and vast health disparities really are in this country.
Yes.
And so Planned Parenthood, specifically Planned Parenthood Southern New England, are at the forefront of this health challenge: how to provide services to some of the most marginalized people, how to keep the doors open, how to follow the guidelines or make your own guidelines, such as they are, around COVID-19. So welcome, both of you, as experts to this, now experts to what is going on with this virus.
Thank you, Babz. Thanks. Good morning. Thanks for having us. We're really happy to be here with you this morning.
Thank you so much. I can't wait to talk about these issues and make everybody as knowledgeable as we are.
So let's get started. So what do we know, and what are we doing, and what should we be doing?
That is a big question. We can start with, here's what we know at Planned Parenthood of Southern New England. First, we know that people's sexual and reproductive health care can't wait, that the health care that we provide is essential, that so much of the health care that we provide is time sensitive, that even during a global pandemic, people need the services that we provide. What a lot of people don't know is that at PPS&E, we also provide comprehensive primary care. And so for many of our patients, we're not only their sexual and reproductive healthcare provider, we're actually their only healthcare provider, and that makes us their primary healthcare provider. And then they may be coming to us actually for comprehensive primary care services. So we have seen that, even in this moment, as healthcare providers across our communities have tried to respond to what's happening, that our patients are still turning to us for the high quality healthcare that they know they can trust us to provide for them. And we have remained committed to being sure that whether our doors are literally open to them for patients that need to come in person or virtually open to them for patients where we can provide their services through telehealth, that we are there for them, and that we are committed to making sure that our doors stay open to them.
And telehealth simply means that through a medium like this, they can access their healthcare provider.
Telehealth is any service that has technology at play, be it a telephone visit, be it a video conferencing visit, much like this interview. Anything where technology is used for the visit is a telehealth visit. That's a good question.
Yeah.
And so
go
ahead.
Well, we've been providing telehealth services at PPS&E for a couple of years, but they were very limited. And so they were limited based on actually the regulations and what we've been able to provide given the regulatory environment around telehealth services in the states that we serve. Remember, at PPS&E, we serve both Connecticut and Rhode Island. And so we were providing very limited services using an app called Planned Parenthood Direct, PP Direct. And when this happened, when this crisis occurred, we're so proud of our legislative champions who worked really rapidly to make sure that they shifted the regulations around telehealth so that we could all play our part, healthcare providers, in helping people stay safe and stay home, but still provide the healthcare that they need using telehealth more expansively at this time. And, I want to give huge kudos to Nicole and to our team at PPSNE. And Nicole's really the expert in what it's like to experience this healthcare and to provide it in that way. In turning on a dime, we went from not having a really comprehensive telehealth service, just having a limited service, to in a week having hundreds of staff trained and ready to be able to provide services using telehealth as the mode of delivery for patients.
So Nicole, talk a little bit about that. So legislatively, your hands were sort of tied around how much telehealth you could do. And then due to the actions of our legislative lobbyists, our legislative activists, they've got those ties changed. And so that allows for us to for Planned Parenthood Southern New England, to sort of provide this service on a much broader scale than what it was initially.
True. A lot of the legislation before COVID-19 had certain barriers around insurance and what a telehealth visit was, who could see a telehealth visit. A lot of those restrictions have been lightened in the face of COVID-19 and the need to social distance. Really, the clinical service team inside of PPSNE, the clinical service leadership, did just a remarkable job in securing a platform, making sure that all of these people were trained to offer this service, and on a dime, like Amanda said, offer these services and prevent lack of access. That is the basis of us providing this service. We definitely did not want to impact marginalized communities, which is who we serve, who already are predisposed to having a lack of access.
Mm-hmm. Okay,
yeah, and
so go ahead.
Go ahead, Babz.
Go ahead, Amanda.
Well, I was just going to say, one of the things that we know is often that while many people don't have internet access at their home, they do have a mobile device, and that's a methodology through which they could still access a telehealth visit. So when Nicole is talking about access to care and using telehealth to close disparities in access to care, it's really important for us to know that we have a secure platform. So the platform that we use is HIPAA compliant, which is, that means that it's got a platform that's secure for patient information, and that the services that we provide, and Nicole should definitely talk about this, because she was actually teaching me about this yesterday, is that telehealth has been provided safely for decades. And that although the regulatory environment was more constraining, that doesn't mean that the actual service is any less high quality and safe than the care that people receive for the same services at an in-person visit. Right, Nicole?
Correct. It's still high quality care. And the thing I love the most about us being able to provide this care and the regulations being loosened is that these are the same clinicians that the community has known and trusted for years. These are the same clinicians that are offering telehealth services. So this is just another means for our patients to access us like they've been doing for decades.
Mm-hmm. And so I would imagine that telehealth is here to stay long after we've come through COVID-19. And do you foresee that being still playing a major role in how healthcare is delivered through PPSNE?
I've often made the statement that the genie's out of the box now. Patients are, starting to enjoy this new normal. It is becoming their new normal, being able to access care from anywhere that they are. I have so many stories of clinicians saying, that they're talking to a patient who is on their lunch break or, is going in their car and having a visit from their car. A lot of the people who are impacted by COVID-19 are in service professions where they are more exposed, they have less access. So imagine being able to, on your 30-minute lunch break, see a provider, where before you would have had to take off the whole day or somehow arrange childcare. You can, in the comfort of your home, your car, quiet, secluded space in a Stop and Shop, see a provider. It's just an amazing thing for the people that we serve to be able to get care anywhere and not have to use public transportation to get there.
Mm-hmm. That's a good point, because until you were able to do that, you would have to take a considerable amount of time to travel to see someone, and to make all the arrangements surrounding that. So it's not as easy as, I'll just jump in my car and go over there. For some people, it is a whole production.
Yeah.
Like putting on a concert, you have to make sure the kids are safe. You have to, check in and make sure you have coverage at your job and all these things. So, yeah. All right. So we know that's here to stay. Talk a little bit about the illumination of health disparities, because that seems to be on everybody's conversation, from the governor of New York to the governor of Connecticut to all across this country. People are really discovering that there is such a thing as health disparities.
I know you say that with a laugh, because you, like all of us in this conversation, know that this isn't new. The thing that really gets me, the thing that really burns me, is that we were talking about this after Katrina, right? We were seeing that, Black and brown folks in the Gulf Coast were already predisposed to certain chronic conditions because they lacked access, because they were in food deserts, because of social determinants of health with housing. All of these things contributed to their poorer outcomes after Katrina. This has been such a long conversation, right? Why isn't there action behind all of this conversation? We saw how it impacted Black and brown people during Katrina. Why didn't the national bodies that write policies and laws do something to make sure that another catastrophe didn't impact Black and brown people so extensively? I think that needs to be the conversation, instead of talking about social determinants of health and social conditions that contributed to the poorer outcomes of COVID-19. What are we going to do about it? That's what I want to hear.
So,
and Nicole,
I'm sorry. How does Planned Parenthood Southern New England, Amanda and Nicole, take on this challenge? Because you all have patterned yourself or moved yourself into a social justice organization. You deliberately made yourself into that, and so here is a real social justice issue. How do you prepare or take this on or address or handle healthcare disparities?
Well, Babz, I think a few things. So first of all, what we don't agree with is the statement from the US Surgeon General, who suggested that Black and brown people need to step up as if they should be blamed for the disparate outcomes and disproportionate impact of this crisis on them. So we reject that narrative at Planned Parenthood of Southern New England and recognize that, as Nicole said, that structural and systemic racism is the contributing factor to this, that this is not that, people are genetically different in terms of their propensity to be impacted by this. It's that people who are in lower income jobs, people who are essential workers who are at higher risk of exposure, and people who, through the sort of ways in which our society is structured, whether we're talking about redlining or reduced access to healthcare, are more at risk of having poor pre-existing health conditions that might make them predisposed to being impacted here. So I just wanted to say we absolutely reject that narrative. In terms of our response, I think there's a few things that I would lift up. First of all, in general, at Planned Parenthood of Southern New England, our mission is that we have three parts to our mission. It's access to healthcare and the delivery of healthcare, but it's also advocacy and education. And I think that our work is to come at this issue from all three of those directions. So first, in terms of healthcare and the healthcare that we provide, making sure that our doors stay open, that we are providing the services that people need. It's one of the reasons that we started to provide primary care, is that we saw that there was an unmet need in the communities that we serve. That's why Nicole is part of our team as our director of primary care services. Also, our provision of telehealth is another way of trying to address this. As Nicole said, we're often trying to find ways to serve people who don't have paid time off of work, who don't have access to childcare, who may struggle with access to transportation. A way that we can ensure that they have access to the healthcare they need is providing it through a more accessible mode like telehealth. On the advocacy front, sometimes folks think of Planned Parenthood in a very narrow lane of just doing advocacy work around sort of the box of reproductive rights. And that's actually not true, because we know that so much of how people's lives are impacted more globally impacts their ability to be able to control their own sexual and reproductive lives, and impacts their ability to make those rights, the right to access an abortion, a real right in their life. And that means that our advocacy work has to address this from all angles. It's part of the reason that, last year we were a big part of the fight for 15. And so we're working on not just sort of our core issues, but intersectional issues that we know will impact these health disparities. And then on the education front, again, a critical part of our work is actually being an educator in our community and having those expansive conversations so that people have the information that they need to be able to make good decisions about their healthcare. So, sort of from my seat as the CEO, those are the things that I would lift up, but I'm sure Nicole has a perspective as a frontline healthcare provider as well.
Sure. Not just as a frontline healthcare provider, but also as a previous patient of Planned Parenthood. I grew up in South Norwalk, Connecticut, where Planned Parenthood was the first choice I made as a young woman to learn about my body. One of the core pieces of what we do is to educate youth about how their body works and about how to properly care for our bodies and how to access healthcare. So that is how we combat these disparities. Knowledge is power. You cannot make an informed choice without first getting the information. And that's all of the services, not some of the services. When somebody comes into one of our health centers, all of their options are laid bare before them, not just some of the options like the administration wants us to do. We are always going to give marginalized people all of the choices that are available to them. And also, we're in a unique position as Planned Parenthood to also give them a voice. That is what the advocacy piece is, that people who are disenfranchised, who do not usually have a voice, we're fighting for those people. And it all goes together with the care that we provide. We are aware of the impact of social determinants of health on the lives of the people that we serve. So in primary care, we are looking at co-location of behavioral health, where we have a therapist in our Hartford North Center who sees our patients. Also, this therapist goes to Manchester a few days a week. So it's from an entire modus of care that we're looking at our patients, and we really treat and care for patients individually. It's patient-centered, not system-centered care. So I'm really proud to work for an organization that looks at every aspect of a person's life. We are fighting for those injustices that contribute to social determinants of health. We are advocating against them. That is how we serve the community, the underserved community.
So COVID-19 has affected so many people across the spectrum, their bottom line. And Planned Parenthood Southern New England is not immune to that. So how do you address this, keeping staffing where it is in the face of having to sort of make tough decisions about how to utilize your resources that you have, your budgets, your staff? How do you stabilize that in the face of having to make hard decisions about, in ways that allow you to keep the doors open? Do you want to speak to that a little bit, or?
Sure. I mean, so you said it exactly right, Babz. I mean, we're not immune. Nobody is immune to the challenges that we're facing right now. No organization and no people. Our absolute first priority always at PPSNE is the safety of our patients and the safety of our staff. And when we have thought about our response as an organization, we've kept a set of guiding principles at the core of everything that we've done. And the first one is ensuring the safety of our patients and our staff. We're working to make sure that we are doing our part as a critical member of the public health community to flatten the curve. We're really trying to center equity in all of our decisions, making sure that decisions that we're making do not disproportionately harm either the people that we serve or our own staff in some way. And that we're also thinking about both our short-term ability to provide our mission, but also our long-term sustainability, because I believe that, as Planned Parenthood has been here for 100 years, we're going to be here for another 100 years, until and unless the world shifts on its axis and all of a sudden the things that we fight for are completely resolved. Planned Parenthood still needs to be here and still needs to be part of the fabric of our society. So those are what we've kept in mind as we have faced some hard decisions. What we have done, is really make sure that we are, for example, as soon as it became apparent what was happening in our society a month ago, we made a decision to work really quickly to launch a telehealth service so that we would be able to continue to provide care, but to be able to provide it in a safe, remote manner. We talked to, with leadership from our clinical staff and thinking about our patients. We made decisions about what services were really time sensitive and needed to be provided in person and in a timely manner, and made sure that we were keeping our doors open to be able to have people access those services. But have also made decisions about creative ways that we can make sure people get even, preventive healthcare services in a safe manner, but without having to come in to the health center for those visits. Like most healthcare providers, like most ambulatory sort of out of the hospital healthcare providers, we've seen an impact in terms of a reduction in our visit volumes. But that's to be expected in an environment where the governor is telling people to stay safe and stay home, and we support that order from the governor, and are just really making sure that we're doing our part to be a good partner in the healthcare delivery system, make sure that we're continuing to provide access to care. Some of the care that we provide is actually a way that we can help the hospitals keep their beds open and help to can't unnecessary patients from being in the emergency department. Think of somebody with acute pelvic pain, perhaps, who might otherwise go to the emergency room if Planned Parenthood wasn't available to see them. So we're making sure that we're available to provide those services, not just for our patients who would normally come to us, but really for anybody who's struggling to access care, and where we want them to not go to the emergency room at a time where they might be risking an increase in their exposure to COVID-19, and also utilizing critical acute care services that right now we really need to protect for the people who need them the most.
Okay, so talk a little bit about how do you, this organization thrives and sustains itself on the generosity of other people giving to it. How do you fundraise in the midst of COVID? Do you change the message of what the need is? Do you change the timing in which you ask? Are those things that you think about as you run this organization? Because everybody, I think, now is raising funds for some aspect of this, either to help people who have lost work, to help businesses sustain. How do you think about that?
Yeah, that's such a good question, Babz. We tell the truth at Planned Parenthood. We tell the truth in the healthcare we provide, and we tell the truth to our supporters and donors. And so, the honest answer is that the message isn't different. The message is that this is an urgent moment for us, just like it is for, a number of other organizations. But this is an urgent moment for us, for our supporters. We do, as an organization, rely on this philanthropic support. We do not turn anybody away at Planned Parenthood of Southern New England based on their ability to pay. So nobody gets turned away from healthcare for us. And the way that we're able to do that is through the generosity of people who stand with Planned Parenthood, who support our mission, and who support us with charitable contributions. So we have reached out to our most dedicated supporters to help them understand the urgency of the moment that we're in. and that it is through their support that we're able to continue to provide healthcare both in person at our health centers. We have had to shift our hours at our health centers. We have made other difficult decisions. I would love to see other organizations make some of the choices we've had to make, including reducing executive pay, to make sure that we are good stewards of those generous donor dollars, that we're making smart economic and financial and business decisions for the organization, and that we're really driving our support towards our mission, towards making sure that we're delivering the patient care that we're committed to delivering, and that we're doing the advocacy work we need to do, because without that advocacy work, it's, you cannot have, it's nice to have access to an actual service, but if you don't have the rights or the policy support to be able to get to those services, they don't do you any good. And again, if you don't have the information that you need, so into our education programs, if you don't have the information that you need to be able to make good choices, it makes it harder to access those things. We really believe that all three parts of our mission are inextricably tied to each other, and all three are critically necessary and important.
Okay. So Nicole, define for us, I was going to say paint us a picture, but define for us, what does healthcare disparities mean? Because that word is bandied around for a lot of people, and I don't know if people really understand what that means. It's another word that has become buzzworthy, right? Healthcare disparity, healthcare. What does that mean?
Healthcare disparity, much like the social determinants of health, mean that there are certain populations because of systemic and institutional racism that are negatively impacted by the systemic and societal racism, right? So, for example, the Black maternal mortality rate. Why is that happening in the most industrialized nation in the world? Why are Black women dying?
Black women, no matter where they are on the economic spectrum, their babies are dying, or they themselves are dying, or both.
Take me, for example. I am a doctorate educated Black woman in America. I should have a good outcome of my pregnancy if I were to become pregnant. Even I would be affected and am affected by those statistics where an educated Black woman has 3 times more likelihood of dying in childbirth than a white woman without high school education. So that is social determinants of health at play. It is the stress of living under systemic racism. It is the predisposition for diabetes, hypertension, obesity, from living in food deserts, from having lack of access, from having lack of good education, from living in social circumstances where you are less apt to access care, and most likely do not have the social support that you need to access good care. So all of that interplays into social determinants of health and what they say disparities, meaning you are disproportionately impacted by these social factors that lead to poor outcomes. Already we know that people of color have poorer outcomes when they are diagnosed with diabetes, hypertension, all of the major chronic conditions. Asthmatic children, for example, Black asthmatic children are more likely to die from asthma exacerbations than their white counterparts. These are things that we have known for many years. The question is, and I asked it before and will continue to ask it, is what is being done about that? Being aware of the health disparities doesn't change the policies that continue to support them and lead to these outcomes. Much like what Amanda said about the Surgeon General, and I echo that statement. I listened to it over and over again, what he said before coming into this interview. And he does a great job up until the end. He talks about all of the social systems that are at play that lead to these disparities and poorer outcomes, and then blames the victim and says, you need to step up. No, the policymakers need to step up. The administration needs to step up. The lawmakers need to step up. That's who needs to step up, because these are not systems that I, as a disenfranchised person, can control. I cannot make it so that I'm not riding a bus to work and cannot social distance. I can't make it that I can't change the fact that I'm in a service industry and have to show up and face people every day at work. He does say that 1 in 5 Black people and 1 in 6 Hispanics have jobs where they can telecommute. The reverse of that is the majority do not. And that is the problem that we have to face and acknowledge, that the social structure and systems that predispose us to have poor outcomes and die at a higher rate from COVID-19, we are dying at a higher rate from all chronic conditions and urgent conditions like COVID-19.
Hey, Babz, can I also just mention one other thing that I think is so important in this conversation, just to build on everything that Nicole said, and is another place where PPS&E is really working to step up, because another critical issue when it comes to health disparities in this country is provider bias, and the way implicit bias plays out in the healthcare delivery system. And this is not, we're not talking about people who are intentionally, maliciously, necessarily, trying to provide biased healthcare. But we know that when you grow up in a racist society, you absorb that into yourself. And there are things, that are at play in our psyches that we're all not conscious of necessarily, but that manifest themselves in behaviors. And I think, provider bias is one reflection of that in the United States that we know sort of at a broad level. For example, that healthcare providers, if surveyed, sort of globally, tend to think that people of color actually have a higher pain tolerance or don't take their complaints as seriously, right? I mean, that's what we're working with. And so at PPS&E, another thing that we have done to try to do our part to reduce disparities in health outcomes is, first of all, we track our own data to look for evidence of disparities, and then try to dig into that and do root cause analyses to understand what's happening there if we were to see something like that. But also, we have worked really hard to do really important, deep, I think authentic work on diversity, equity, and inclusion inside PPS&E, on understanding what it means to engage with people of other cultures, other lived experiences, all across all the differences that make a difference among us, but so that we as an organization can feel confident that we have done our part to do training and learning internally so that our providers and our organization as a whole is showing up with greater capacity to not display that type of bias in the way we do our work.
So this brings me to my next set of topics for conversation. Census 2020. And I understand that PPS&E is taking on supporting the Census 2020, that everyone should be counted. And so talk a little bit about why that is important for Planned Parenthood Southern New England, and why is it something that you, and do you think the Census 2020 will help at least make some inroads to offsetting healthcare disparities? Can we make that jump, that leap, that if we work on census stuff and be counted, that we can offset some of these disparities?
Yeah. Thank you so much for giving us an opportunity to talk about this, Babz. We have been committed to working on the census. The census is done every 10 years. And what a census is used for, so the census is a way of counting all of the people in the United States. And then what the census is used for is attribution and disbursement of resources, critical social service resources like WIC and CHIP and Medicaid dollars, but also resources like ensuring that you have appropriate representation as a community in the United States House of Representatives and how many seats you get there. So if not everybody is counted, then A, a community is not going to get the resources that they need, and B, they may not even have the representation that they need at the national level to be advocating for their community. So it's absolutely, like, if anything, I would say that this pandemic has made it even more important that people complete their census. And at a time like this in our society, I think it would be possible for people to be nervous about completing the census. And so part of what we have really focused on is educating people about the census, that it's safe, that it's easy, and that it's important. You know, there was a fight back. The administration tried to include a question about citizenship status in the census, but that was fought, and that question is not there. So the census is safe. It is safe for people to complete the census. It is simply a way of counting every person and making sure that a community is getting the recognition it needs for the number of people that live there, and therefore the resources that community will need. So, and then why is PPS&E doing this? You know, somebody might say, like, why would Planned Parenthood care about this? But as we've talked about before, so first of all, advocacy is a critical part of our mission. It's one leg of our three-legged stool. Second, you know, we've talked about the fact that Planned Parenthood of Southern New England typically serves people who are otherwise marginalized by the broader healthcare delivery system, but also, you know, in our society. And that means that as we have done our work and worked to engage with community partners and worked in our communities, we have relationships and partnerships where we can work with other organizations and together really get the message out about the census. We have capacity and resources to be able to do that as well, which means that it's our responsibility to step up at a time like this and do that work to help make sure that everybody is counted. And we actually, this was another place where we turned on a dime and were able to shift from, you know, the way we would normally do work. We'd be out, like, you know, in communities, having conversations, talking to people, going to churches to talk about the census. But in this environment, that's, you know, all out the window, right? So we switched and shifted it to a digital campaign. So if you follow us on social media, if you know, participate in community online conversations, those are ways that people can get the information that they need about the census. And there are so many other organizations doing this too. So, you know, I hope for people who are listening to your show, whoever is your trusted resource, if you haven't done your census, please do your census. Don't be afraid. It's safe. It's easy. It'll take you just a moment. I went online and did mine. It's so important to make sure that every single person is counted. That is how we make sure that every single person's voice has even the opportunity to be heard in this society.
And, you know,
want to add to that, Nicole?
I absolutely. The tail end of that is, you know, Planned Parenthood is such a unique organization. When we're looking for long-term projections of what we're going to do next, like when I was designing the strategic plan for primary care, we want to hear the voices of our patients. We have patient panels and we directly seek information from the people that we're offering services to. The government is not necessarily like Planned Parenthood. So if you want to count, you literally have to fill out your census so that you are counted and that resources are allocated to your neighborhood and to organizations that serve you. And that you then have a voice on the governing bodies, like Amanda stated. So the census is vital to marginalized communities. We need every Black and brown person to be counted so that we're equally represented.
And we know that the communities we serve are typically undercounted and underrepresented. And it's why we're, like, you know, being so encouraging right now in doing this work. You know, people of color, immigrants, low-income people, LGBTQ people, the populations that we prioritize our services for at Planned Parenthood of Southern New England, you know, single mother households, typically undercounted. We need to make sure that those voices are heard, that those folks are counted so that they have a way to have their voice be recognized.
So there's a couple of things before we wrap up. What are you hearing across the Federation on how other Planned Parenthoods are dealing with this? all Planned Parenthoods are not equal in a sense. Some have bigger challenges. Like if you're in the South, you have a different set of challenges in front of you. If you're somewhere else, you have a different set of challenges. You have a different set of challenges here in the Northeast. Paint us a little picture, Amanda. What are you hearing across the spectrum?
Well, you're absolutely right, Babz, that, Planned Parenthood is as a membership organization. We're a federated, affiliated organization. This Planned Parenthood, Southern New England, we represent Connecticut and Rhode Island and provide services in those states. And every Planned Parenthood is unique because it's impacted so distinctly by the environment that they're in. And that environment includes their political environment. It includes the demographics of the communities that they serve. It includes things like access to healthcare through other providers in the communities that they serve. So every Planned Parenthood is really different. The extent of support that they get in their communities. We're so fortunate here at Planned Parenthood of Southern New England to have, have been able to advocate for and pass laws that protect access to abortion in both Connecticut and Rhode Island. Here in Connecticut, and in Rhode Island, actually, the attorneys general in both states, Attorney General William Tong here in Connecticut, Peter Nerona in Rhode Island, both signed on to a coalition of attorneys general submitting an amicus brief to oppose the way that the Attorney General in Arkansas is trying to use this crisis to restrict access to abortion. We've seen that in Texas, that the state also used this crisis, and in a number of other states, but Texas has gotten a lot of a lot of eyes on Texas to reduce people's access to abortion by saying that abortion is not an essential service. And I don't know, if abortion's not time sensitive, then what is? So if you're in a state where they've said that, in Texas, they literally had to have grief counselors available in the waiting rooms of the abortion providers for the patients who were being turned away from care because of the actions that the state took. And so, all Planned Parenthoods are being impacted differently, and all Planned Parenthoods are doing, in their own way, in their environment, the same sort of type of work. We're advocating for our patients in the communities we serve. We're providing healthcare to the best of our abilities, but that is different in certain states where they're so constrained by a really hostile political environment. People who, are using this crisis as an opportunity to take away people's rights, to control their own individual bodies, and so we're all sort of operating in that three-legged stool mission, but in very different environments.
Does it tickle you or incense you that these protesters are using pro-choice language in their quest to get the states to open their economies back up? Have you noticed that they're using
I have noticed that.
They're using the language that historically has been the language that we have been using. Those of us who are always on the front lines of a woman's right to choose, they're using language about right to choose as they protest. Does that incense you or tickle you?
Mostly it confuses me, Babz, because here's what I would say about that. I am no longer a practicing healthcare provider, but for 10 years I was in clinical practice. I'm an advanced practice nurse, not a DNP like Nicole, but I am an advanced practice nurse. And I was in practice for 10 years. And what we know about this moment in our time, this COVID-19 crisis, this is something that is highly contagious. It is deadly. That if you refuse to follow the guidelines that the states have put forth in terms of staying safe and staying home, if you refuse to wear a mask when you're in public, when you've been advised to do so, if you refuse to not congregate in groups, we've seen people congregating in large groups, then it is not about your body. If this was just about an individual body, that would be a different conversation. It's not. This is about people impacting the lives of other people. People become vectors when they gather in large groups, expose themselves, and then may be asymptomatic. And if they're choosing to flout these either recommendations or requirements, depending on their state, and not follow those guidelines, then they are exposing other people. They may be exposing their grandmother. They may be exposing their child. And it doesn't even have to be somebody you know. You're exposing somebody else's grandmother. So mostly it confuses me, because we are not talking about this. This COVID-19 crisis is a crisis where our individual behaviors have a multiplying effect across countless other people, countless other lives. So I find it confusing.
I find it apropos in the way that, you do have the anti-vaxxer movement that does not believe that their children should be vaccinated, which has affected herd immunity. And you do see a rise in preventable childhood illnesses like pertussis and children dying of vaccine preventable illnesses, right? I think it's a similar thing where individual rights, we live in a country of freedom, tout and pretty much stomp on the rights of the unified community, right? Humanity in general. I don't know what's happened that people no longer trust professionals that specialize in a particular profession. As I was writing guidelines and policies to manage and comply with what the CDC and local governing bodies said for COVID-19, they became confusing. And when I got stumped, I picked up the phone and called the epidemiologist at DPH in Connecticut or DOH in Rhode Island. Because guess what? I'm not. Even though I'm a doctorate prepared APRN, I'm not an epidemiologist. I don't understand this desire or this belief that professionals who study for years to understand a particular topic shouldn't be believed. If I need open heart surgery, I'm going to listen to what the open heart surgeon says. So right now, in the middle of a pandemic, I'm
right.
to the epidemiologist.
Maybe we should listen to the public health experts.
Yes. Yes, that's a good idea. Thank you so much for you two being here this morning. I think this was a well-rounded discussion. I think there was a lot of information shared. Tell people how to find Planned Parenthood Southern New England.
Thank you so much, Babz. I was so hoping you would ask me that. So, if people want to, one of the best ways for people to support Planned Parenthood of Southern New England is to come to Planned Parenthood of Southern New England for care. So you can call us to make an appointment. You can go to our website at www.ppsne.org. For people who want to support us financially, you can go to ppsne.org/donate. For people who, maybe just want to start to engage with us and learn more, they can start following us on social media. You can follow us on Instagram. You can follow us on Twitter. You can follow us on Facebook. We also have accounts for Planned Parenthood Votes Connecticut and Planned Parenthood Votes Rhode Island, which are our advocacy organizations. So if you're really concerned about advocacy work and you really want to make sure you're staying on top of what we're doing there, if you want to learn more about the census, you can go not only to our PPSNE social media sites, but also to our Votes, PP Votes social media sites. You can follow me at Amanda Skinner PP on Twitter. I know you're one of my followers, Babz.
I am.
Yes, you're a great follower. Thanks for the likes and retweets. You can follow me if you want to learn more about sort of our priorities and what we're doing right now. So there are a lot of different ways to engage with Planned Parenthood and learn about our work, help support us at a time that's really urgent for us so that we can continue to provide essential healthcare to the communities that we serve, people who often really struggle to access care in the broader healthcare delivery system, and make sure that we're able to continue to do our advocacy work and to continue to provide the best high quality sexual and reproductive healthcare education out there.
Thank you so much, Amanda Skinner. I appreciated your time this morning. Thank you so much, Dr. Nicole Phillips. I appreciated your time this morning.
Thank you.
I look forward to having you back for further conversation. Thank you, Harry Droz, for another great show. And I'll see you all out here on these virtual streets in no time.
Thank you.
Thank you.
Thanks for having us.